Hello, everybody. Welcome to It's Worth a Shot. I believe this is our 23rd session of this, I was told today, which is pretty exciting. Today, we're going to talk about technology in your practice and then also talk about long-term COVID. We have our sorry, go to the next slide. Sorry, I just want to let you know there's a couple housekeeping items here. We are going to record the recordings or record the webinar. So if you are not speaking actively, can you please mute to make sure we limit the background noise? And then also the slides and the recording will be emailed out after it is done. We do have a polling question today, so I'm going to ask Mary to pop it in there before we start the webinar series today. So Mary, if you can populate that, there we go. So I'll give you a couple minutes to answer this. Not minutes, actually seconds, but the question is right now, I know where to get information or training materials on. Sorry, I do have a new puppy, so if you hear some squeaking in the background, that's me trying to entertain him, so we don't have a mess on our hands while I'm talking. I apologize. Okay, looks like we've got about 14 of 30 response, so we'll give it a couple more seconds here, and then Mary will close the poll. Okay, I'm going to ask Jesse, do you want to pop off of mute by any chance to kind of go over this, or are you good with the results and we'll move on? I think we're good, we'll go on. Okay, so next slide. All right, we just want to thank you guys for showing up to this every week. I know 23 weeks is a long time to do this. We'd only anticipated, I believe, doing it for 13, so we're going strong, which is good. And we also want to remind you that if you can think of any topics that you think would be worthwhile to go on over this webinar, please do send them to one of us, and we'll make sure that we get that on our schedule. Next slide. So today I'm going to be talking a little bit about technology in your practice or, in your facility. And I'm actually focusing on QR codes, which are actually quick response codes if you're not familiar with those. Next slide, please. Okay, so QR codes, I'm not sure if you're familiar with them, but I'm sure you've seen them places. So QR codes are used for a lot of different purposes. They are machine readable codes that store URLs or can navigate to websites using the camera on your smartphone. They're a modern way of navigating information, and they also have very versatile uses for them. So some of the examples that I have for you would be, I don't know if anybody's gone to a restaurant during COVID times, but if you notice there were menus. They actually had QR codes posted at a lot of tables where you would just pull out your smartphone, turn your camera function on, and then point it at this box. When you look at the box or below it, it would populate a pop-up that you would tab, and that would take you to an actual web page, be it the menu or information about the restaurant or what have you. So these have not new, they've been around for a while. They've been on ad campaigns, like if you want to find out more information about a movie, or if you want, some people have them on their business cards where you can actually go to their business page and find out information about their practice or what they do. Next slide, please. So what we want to talk about today is a bit about how to actually use them in your facility to promote things. There's a mix of things that you can actually put with them. So there's many ways to create a QR code. That might be your first thing, like how do you get these? A quick Google search will actually take you and show you free programs of how to actually create the QR codes. And QR codes, as you can see in the image here, it's something you would scan with your camera, and it's something you would put on printed materials. You've also sometimes seen them on virtual materials, like on your TV screen or things like that. When you look at the QR code through your camera, you would tap an actual web address, and then it would take you to that web address. So you could use it as in education for your patients, or you can use it, there's just ample uses that you can have for it. So it's a solution for helping people access information without having to actually manually go and search for it. So you can see them on business cards, like I already said, posters, postcards, or other direct mail pieces, packages, boxes, and magazines, etc. You can also see them on TV and internet sites. They're also a great solution for restaurants during COVID, which I talked about there with you, but there's a vast majority of people that have smartphones, including employees within facilities. So instead of having to print material out on paper and hand it out, or display it on poster boards and things like that, or have handouts that you need to pass out to visitors that come into your facility, you can actually just have one placard that has a QR code, and their smartphone will now take them to that landing site of where you want them, and it will display all the information that you need. Be it, let's just say in a facility, for example, that has had an outbreak of COVID and they're under restriction for visitors, and there's different protocols that they have. They can actually have that set up to where you have a QR code that will take them to a website that has the information about your facility's restrictions at this point in time. So therefore they can read that, and you can have it posted at the front door prior to them coming in. Another example you can use it for is screening. So if you have specific screening purposes for your visitors, you can have those documented at a website, and then you can have that QR code at your front door, and it's scanned. And so that way the person that's coming in is aware of what the procedure will be. Their temperature will be taken. They'll be asked if they've had any exposures. They could potentially have a test, if they would want one. You could spread information about vaccines and boosters during the same thing, if that's what you would like, as well. But the thing is that because we're in a smart society with all the smartphones, it's less print and less documentation and more mechanisms like this that are moving on. Can we go to the next slide, please? So these are some examples that were just how the QR code assisted during COVID. So, I'm sure you saw posters that had QR codes about the spread of the vaccine information. So like if you saw a poster somewhere, 9 times out of 10, there was a QR code on it where you could do further research on the topic of what's in it. Also for print ads with QR codes on it for the nearest testing sites, so you would see maybe a commercial that would have a QR code where it would link you to a site that said, this is your area, put in your, zip code, and here's where you can actually get tested for COVID. And then once you got to that testing site, a lot of times there was a poster board or a sign someplace where before you even got up to testing, they would have you scan the QR code, and then it would take you to registration where you would fill out all your information prior to having your test for COVID. And also it would tell you, where you would get your results and, things like that. And then lastly, there are poster boards at COVID-19 testing sites that give you a walkthrough, of what to expect. Or a lot of times when you were on a plane and you were coming back into your state or leaving your state and going someplace else, and there were travel restrictions during COVID, same thing. You would see QR codes posted throughout the airport that you would scan with your smartphone, and then it would tell you like what you needed to do prior to getting out of the airport. Like, did you have to be screened? Do you have to be tested? Different things like that. So it's a great way to pass the knowledge on without having to have print material that you're now passing out to everybody, or have somebody, have to stop and read a poster board from top to bottom about what all of the changes or information are. Next slide, please. So I know we talked a bit about how they were used in COVID, but there's different ways they can actually be used within the nursing home as well. Like if you have different menus for things that, a menu for a week, or activities that are going to be coming up, or, a monthly calendar, I know residents in nursing homes are not necessarily brought up in the smartphone technology world, but that does not mean they don't know how to use them, so you could actually have a QR code that takes them to your resident life page, so then they could find out information on their own. But vice versa for that, you can also have QR codes for the family that comes to visit or visitors, where we already talked about it earlier. You can see what status you're in for a COVID outbreak, or what activities are going on, or just different information that you would quickly like to share with visitors and people that come to visit. Now, I do want to clarify that the QR codes, or the quick response codes, they are a mechanism for them to scan on their phone to get to a landing page. So sometimes it's just a URL, or a web page that you're going to. Sometimes it's to a specific resource. Like we at Mountain Pacific, we have some resources that have QR codes on them, and it will take you to our website and to that specific resource. But because you're now at our website, you can navigate throughout that. So just because you have a QR code does not mean that you don't have to update or maintain the information that is the landing page for that QR code. And then moving on for staff and contract staff, this is a great way that you can have updates, or if there's going to be meetings coming, you could have an actual page that has all that information, where if they don't have a calendar of the events, or if there's information that they need to know, that you can have a QR code created where they just scan it as they're coming in, to work or whatever. It can see what any updates possibly are, or things like that. Or also if there's training that you would like to do. Like I know that CDC has the Project First Line, which we've talked about that here. But there are QR codes that go with that training, to where, so if you wanted somebody to, or if somebody wanted to access those little 5-minute videos about hand hygiene or gowning or PPE equipment or whatever, you could have the QR code posted for that Project First Line information on a bulletin board, and then they can scan that and actually watch the information and themselves. So those are just a couple of the uses with QR codes that we could think of that would come in the facility. Does anybody have any questions about that? I know I went over fast, but we're just trying to explain that you could use different technologies to actually kind of make things at an infection prevention standpoint a little bit more sanitary, without having to have paper and other things out available. Did we have any questions or anything? Any statements? Can anybody read through the chat box? If we don't have any at this time, then I'm going to go ahead and pass it over to Dr. Kunzweiler. Let me do a little introduction for him. So Dr. Douglas Kunzweiler is our Chief Medical Officer for Mountain Pacific. He oversees the clinical and review activities and promotes quality and transformational change in the healthcare settings across Mountain Pacific's multi-state region of service. Dr. Kunzweiler has more than 40 years of healthcare experience, starting as a certified nurse assistant in a long-term care facility in Imes, Iowa, and finishing in St. Peter's Health in Helena, Montana. He retired in 2018 after being an emergency department physician for 27 years. He's a certified with the Board of American Academy of Family Practice, and has cared for patients at every point of their lives, from neonatal care to advanced care planning. Dr. Kunzweiler has been an advocate for serving the health and serving the health and the healthcare needs among disparate populations. He has traveled around the world to serve his country in the U.S. Air Force, Army Reserve, and Army National Guard, receiving the Air Medical with Oak Leaf Cluster in 1972 and the Army Commendation Medal in 2007. There we go. In the last 2 years, Dr. Kunzweiler has done a lot of speaking about vaccine hesitancy and COVID-19 facts in a variety of groups, including AARP, town halls, and the Montana Health Care Association, and others. Now that I've stumbled over that quite a bit, let me go ahead and pass it over to you, Dr. K.
Thank you, Miranda. So I have done a lot of talking about COVID, and because of that, I've done a lot of reading and learning about COVID, and I've been fully vaccinated for a while. Long COVID is pretty interesting, also known as post-COVID-19 syndrome, if you want to get all scientific about it. Could you go back to that, please, Mary? The first slide. Or long hauler. And long hauler is what people who are experiencing these symptoms first began to call themselves. And they really brought the medical community's attention to this problem. There weren't any clinicians talking about it until people began telling them, look, I'm a couple of months out and I still feel awful. Another name for it is post-acute sequelae of COVID-19 or chronic COVID syndrome. Okay, next slide. So what is long COVID? Well, I recited all of those names, and that's just a portion. There are other names. Anytime you see a lot of different names for a syndrome, it means we don't really know what we're talking about. This is something new that really hasn't been experienced before. And because it's new, people haven't really settled on a definition. There are people saying if you have symptoms beyond 4 weeks, you've got long COVID. There are others saying, no, it's 3 months. In Great Britain, they're using a 6-month interval. If you have symptoms that go longer than 6 months, then they are calling it prolonged COVID syndrome. For most viral illnesses, influenza would be a good example. You're sick for 10 days or so. You feel crummy for maybe another week or so. So over the course of about 3 weeks or so, you finally start to feel like you have your old energy back. Some lucky people, of course, are not, feel better long before that, but typically a couple of weeks. However, with COVID, we've seen people whose symptoms have persisted much longer than that, and not just mild symptoms. Some of them are debilitating to the point that they've disrupted their normal life. And there are now people who have had documented symptoms, significant symptoms, for over a year. Because we don't really understand it completely, because we even have trouble deciding on a definition, it's important to realize that this is a diagnosis of exclusion. That means that you have to make sure it isn't something else. In medicine, there are many syndromes, many diseases that have overlapping symptoms that look like other things. So you really need to do some testing and make sure that what appears to be long COVID isn't actually, a hypothyroidism or anemia or some other medical diagnosis that could possibly be effectively treated. Next slide, Mary. Next slide. So what symptoms persist? Well, the most common ones people complain of are fatigue, and not just the usual kind of I've been working hard and I feel tired. Fatigue where you have difficulty getting out of bed in the morning. Fatigue that prohibits you from going to work or doing your normal daily activities. Another very common symptom is breathlessness. Not so much cough, just shortness of breath, feeling like I just can't get enough air. And then brain fog. And I put that in quotes because it means different things to different people. But generally, people are talking about they're just not sharp. They have trouble remembering things. They have trouble concentrating, just not themselves. Then there's a whole litany of other symptoms, all of which have been described with acute COVID-19, and sometimes these persist. And you can read the list there. Some of them, can be fairly mild. Low-grade fever, for instance, is common, but people don't feel well when they have a fever, and this persists for weeks or even months. Altered taste and smell is one that got a lot of publicity, especially earlier in the pandemic, but a lot of people are getting months out, a year out, and still don't have normal taste and smell back. And that's really not a minor problem. There are people that are having trouble maintaining their weight because nothing tastes good to them. They have trouble eating. Chronic kidney damage also is being seen. Heart rhythm problems, palpitations, anxiety, depression, and even blood clots. And some people have had strokes, significant blood clots. Almost any symptom you can think of has been described by people who have long COVID. The points I really want to emphasize in this talk is that it's quite clear now that prolonged COVID or long COVID is very real. People aren't imagining this. And it's quite different from other viral illnesses. We certainly see viral illnesses. Mononucleosis would be another good example where people take 4, 5, 6 weeks to really recuperate from it, and they may have a lot of fatigue with it. But this is quite different. This is lasting much, much longer, and some of these symptoms are much more profound and much more serious. Next slide, Mary. Who is at risk? Well, pretty much everybody. One generalization you can make is that the sicker you were with COVID-19, the greater the likelihood is that you're going to have prolonged symptoms, especially if you were on a ventilator or you were in ICU or had a prolonged hospital stay. And of course, anybody that fits those descriptions from some other cause, let's say you have bacterial pneumonia and you wind up in ICU, you're going to have a long convalescence. But one thing we can say about long COVID is that if you were really that sick that you had to be in the hospital or you had to go on a ventilator, there's a good chance that you're going to have some long-term issues. After having said that, it's also true that people who have fairly mild symptoms or maybe moderate disease, they also can have persistent symptoms. It also seems to be true that the more deconditioned you are before you get COVID, the greater the chances that you're going to have a long recovery. The older you are, your chances go up that you're going to have persistent trouble. Females have a slightly higher risk than males. It's not real dramatic, but females are at slightly increased risk. Obesity pretty clearly is a risk, and obesity is a big risk for severe COVID to begin with. And then asthma, underlying lung disease, and really any chronic disease puts you at increased risk of having COVID symptoms that are prolonged if you catch it. Heart disease like high blood pressure, heart arrhythmias, congestive heart failure, those things, any other kind of lung disease, chronic connective tissue diseases like lupus increase your risk quite a bit, really almost any chronic disease. Next slide. So what causes this? Why are we seeing these prolonged symptoms? Well, again, this is new. We haven't really run into anything quite like this before, and nobody's completely sure about this. It has been under intensive study, especially in the last half year or so, as the medical community has realized, this really is a big problem. Some of the theories are that it could be just the toxic effect of the virus, that the virus damages tissue somehow all by itself, and that causes these chronic symptoms. I think the theory that is more in favor right now is that the virus somehow triggers a chronic inflammatory response. And that is that it gets the body's own immune system to overreact to the viral insult and attack its own tissue. And in that way damages small blood vessels in various organs. And in that way it's able to affect the brain, and how your thinking works. It's able to affect the kidneys and cause chronic kidney disease. It's able to affect the GI system and cause this nausea, vomiting, diarrhea, and so forth. There's another theory that it does this primarily by attacking the kidneys, and the kidneys really are responsible for regulating blood pressure in human beings, and they do it through a couple of hormones, particularly renin and angiotensin. And the virus has a particular affinity for angiotensin receptors, which are found on many different tissues. They're found in the lungs, they're found in the heart, they're found in the GI system. And it's thought that maybe the virus has a particular effect on the hormones that those receptors are triggered by, and that's how it's causing these prolonged symptoms. And very safe to say that a lot has yet to be learned. In terms of how big a problem is this, again, if you can't agree on the definition, it makes it really hard to know exactly how big it is. I've read estimates that about 23 million Americans are suffering from long COVID, which would represent about, I don't know, 6-7% of the entire population. So it's quite clear that it's a pretty big problem. Next slide. So how do we prevent it? Well, we don't really know. One thing is don't get COVID in the first place. So get vaccinated, avoid risky situations where you're more likely to contact COVID. Try to stay away from people that you know are infected. And then other just general recommendations for prevention. Stay as healthy as you can. Eat well, like a Mediterranean diet, low in processed foods, high in raw fruits and vegetables. Exercise regularly, and just walking 20 to 30 minutes a day at a brisk pace is fine. And make sure that you see your providers and keep your chronic conditions, your high blood pressure, your diabetes, your heart failure. Make sure that you are optimizing the treatment of those. Stay fully vaccinated, including that fourth shot if you are of advanced age or you have a chronic illness that would mandate that you get a fourth shot. And avoid likely exposure whenever possible to COVID. Don't be afraid to wear a mask in situations, especially big groups in a small area with poor ventilation. That seems to be one of the really prime ways to get COVID. If you do become infected, consider taking some oral medication. There are a couple of medications, antivirals, that are approved for treatment of COVID. They're not being used as much as they probably should be, but if you do get COVID and you go on an oral medication, you do reduce your risk of having long COVID, long prolonged symptoms. Next slide. Well, what do you do if you have long COVID? Well, it's sort of grim. One of the first things I would do is try and find a physician or primary care person who is willing to treat people with the syndrome. Again, because this is sort of new, there are providers who either haven't kept up on what's been going on or don't believe that COVID exists, but find somebody who has been treating people with the syndrome. You can check on the internet. There are support groups where new information is shared. Perhaps information about good providers could be found there. But you also have to be careful because not everything on the internet, of course, is true. So you have to be kind of careful about, try to use, credible sources like World Health Organization, National Institute of Health, those kind of things. And then look for a provider that you trust who believes you. Sometimes that's easier said than done. And again, what I want to leave you with is that long COVID is real. You don't want it. It's a nasty, debilitating disease, and it can make life miserable for what were formerly, healthy, active people. So that's all I have for my presentation. Get your vaccines, be careful, try and stay healthy.
Thanks, Dr. K. I just want to say a special thank you to all of our guest speakers, the collaborating partners, and the attendees who continue to support the needs of our long-term care facilities across the regions. So a big thank you to all of you on the call. If you have any questions about what we presented on today, or if you would like any further information, don't hesitate to reach out, to email us, to ask questions, and we will definitely answer them to the best of our ability. So thank you, everybody, for being on the call today. And if we don't have any questions, I think we can call it a day. Are we good? All right, thank you.